ladies and gentlemen, the children are coming up with a disease that is linked directly from COVID 19. They call it Kawasaki disease. And right now it's linked to 73 children over the last few weeks. So this came out in the New York Post, May 8th, 2020. Kawasaki disease. What to know about the illness linked to coronavirus. Yet another scary illness has emerged from the coronavirus pandemic, and it affects children, a condition that looks eerily similar to Kawasaki disease. As of Friday, 73 kids in New York State have been hospitalized with symptoms that mirror the rare, life threatening inflammatory illness. This is every parent nightmare. Governor Andrew Cuomo said in a press briefing following the death of a 5-year-old New Yorker on Thursday. State health officials alerted medical providers Wednesday with the potential association between the virus and Kawasaki disease. The majority of the patients with the disease have tested positive for COVID 19 or COVID fighting antibodies, according to a new state health department report released Wednesday. It's still too early to say for sure if the coronavirus cases have Kawasaki disease for sure. That's why doctors have started calling it Kawasaki like, says Dr. Leonard Krylov, chairman of pediatrics at NYU um, Winthrop Hospital on Long Island, and a pediatric infectious disease specialist. I think COVID 19 is just so complicated. It's like every single week something new comes out about it. It was just a few days ago we were looking at COVID toes. And I know True Royal did a video on now they're finding COVID 19 in the sperm. And now you have Kawasaki that impacts kids, and that comes from coronavirus as well. I mean, it is just so complicated. There is no damn way you can call this like a flu. This is nothing like a flu. I've never seen the flu do this to people or do this to children. This is not a flu. So those of you that like to downplay everything and try to act like, it's just like the flu. What's the big deal? Really? Show me a case of the flu where you saw these kind of lesions on a child's body. Show it. Okay. So Krylov have been tracking Kawasaki disease in children since its emergence in the US in the late 70s and says the new link is concerning, but could tell us more about the mysterious coronavirus. So it just go to show you all the way up until now, the medical scientists and the doctors, they have no clue. They're learning about this probably at the same rate the rest of us is. Wow. It's telling us something about the virus and how the body responds to it in different ages. Krylov, who has treated patients with both COVID 19 and Kawasaki like illness, tells the Post exactly what it's telling us. We don't know yet. Here's everything doctors know so far about the rare but potentially fatal illness. What is Kawasaki disease? Kawasaki disease is a rare childhood illness, is potentially fatal, and causes the walls of blood vessels in the body to become inflamed. How is it caused? Scientists aren't sure what causes Kawasaki disease, which has only recently been associated with the coronavirus. It occurs often in people of Asian and Pacific Island descent, and some research point to being genetic. Even though we don't know the cause, the fact that it happens after 5 or 6 years old, it's thought to be an infection people develop immunity to, Krylov said. What are the Kawasaki disease symptoms? The symptoms include a fever that lasts at least 5 days, a rash, and strawberry tongue. Yeah, I saw that. The tongue looked like it's got a bunch of lesions on it. And some children, when I was looking at some of their tongues are the color of a strawberry. It's red. Others include swollen hands and feet, bloodshot eyes, and swollen glands in the neck. One of the symptoms of the disease is a swollen and bumpy tongue called strawberry tongue. The tongue turns almost beefy red, and the taste buds stick through it. Mm, yeah, it really does. Wow. In Krylov's experience, there have been some differences between the typical Kawasaki patients and those who have the coronavirus and exhibit symptoms of the disease. Both have swollen lips and strawberry tongue, as well as a fever and rash. Patients with the coronavirus additionally have kidney inflammation. Damn, kidney inflammation, abdominal pain, and diarrhea. These patients haven't had as much of the redness in the hands and feet that typical Kawasaki patients have, Krylov said. In Kawasaki patients, it looks almost like they're wearing red stockings on their hands and feet. Wow. But it's not clear if it happens in the COVID patients with the Kawasaki like illness. More testing and observation needs to be conducted before doctors prove a link, Krylov said. This new cluster don't seem to be related, but it's not 100% nailed down, Krylov said. Not all children who have this had tested positive for COVID. However, they may have been exposed to someone in their family with it. There is no test for it. So they have no tests for this Kawasaki disease that's showing up in kids. Doctors have ruled out other similar diseases and factor in signs and symptoms. Is Kawasaki disease contagious? It's not contagious. However, the coronavirus is. With the new link possible, that between the two, it's more important than ever for kids and their families to social distance, wear masks, and wash their hands frequently. Kawasaki disease treatment. The treatment includes either aspirin or infusion of an immune protein called gamma globulin through the veins, which can lower the risk of coronary artery problems. Wow. For coronavirus patients with Kawasaki like illness, the treatment shows promise, Krylov said. He and his staff have treated one child and saw positive results. Whether it's a coincidence or not, within a few hours, he was back to normal. One case doesn't tell you everything, but it's possible that this could help. Okay. Children Younger than 5 are the most at risk, but older children and adult can also get it. What are the complications? Complications from Kawasaki disease include heart complications such as coronary artery. Oh, right. Wow. I mean, these kids can get this thing and end up with heart problems? Oh, this is this is crazy. You can have children having heart attacks at a young age, Krillov said. However, he adds that this is exceptionally rare, especially with treatment. What the heck? Children can have heart attacks from this stuff? Oh, this is crazy. All right, here's a video of Cuomo. I'm going to play this audio for y'all. Hear what he says.
While rare, we're seeing some cases where children affected with the COVID virus can become ill with symptoms similar to the Kawasaki disease or toxic shock like syndrome that literally causes inflammation in their blood vessels. This past Thursday, a 5-year-old boy passed away from COVID related complications, and the State Department of Health is investigating several other cases that present similar circumstances. This would be really painful news and would open up an entirely different chapter.
Wow. Wow. Now there's something that's impacting children. Y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.